Hi, today I'm going to talk about disorder and abnormality of GU system. What you need to know about GU system on pediatric is that UTI, Nephrotic Syndrome, and Acute Glomerulonephritis. Let's start from UTI. UTI, what we have to know is that the first sign in the infants and on the child is that we have to concern about poor feeding, poor appetite. UTI is more common in girls because we have a short urethra. What we concern about is dehydration. Let's go to the goals of prevention and treatment is to reserve the renal function and prevent spread of infection. Okay, the child who have nephrostomy, they will have a problem with image disturbance and a fear of dialysis. What else? So testicular torsion, this is emergency surgery that we have to treat. It's very painful. It's on assessment you can do with when the parent present or without the parent presence. Okay, so the cryptorchidism is under descendants of the testes. Bilateral may have a problem with infertility. We have bladder extrophy. It's like this protruding of the bladder. So make sure that we have the moist dressing over it, and we have to keep the child warm. The risk of infection is the main concern for this one. Usually the surgical repair, the child will be fear of the mutilation. It's like perceived of punishment because mostly preschool age. Nephrotic syndrome usually happen with post-glomerulonephritis. The signs and symptoms you have to watch for is proteinuria, the hyperalbumin, and the hyperlipidemia. So basically, like they have the albumin in the blood vessel, very little because the protein, the albumin, is shipped to the tissue. Basically, we call third spacing, and the hyperlipidemia. So you have a fat in the blood, and also you get edema because of third spacing, ascites. This is because of the shift of the albumin. So what we have to watch for is that signs and symptoms is weak skin, edema, anorexia, decreased urine output, and irritability. And the test that they can do is renal biopsy. So they cut the pieces of the kidney and doing biopsy. So with nephrotic syndrome, the treatment usually they use steroid 1 to 3 weeks, and we do tablet after that, and diuretics like Lasix, and also low sodium. Sometimes because of the protein, we're losing protein in urea so much, so you will get the albumin IV to replace protein. And for nephrotic syndrome, is no hematuria. Okay, the goal of the treatment is to reduce the excretion of the protein and to decrease retention and prevent infection. So what we can do as a nurse is we have to do strict INO, intake and output. We have to weigh the patient daily, we check vital signs, and a good nutrition, especially protein, because they lose a lot of protein on urine. Okay, next one we're going to talk about acute glomerulonephritis, which is come from the bee strep, so which can cause rheumatic fever. You know what it is. So signs and symptom is oliguria is like not that difficult. It's just like they have small urea. Edema, hematuria is a hallmark of acute glomerulonephritis. Also proteinuria, the same as nephrotic syndrome, hypertension, and circulatory congestion like cardiac problem, whatever. So the diagnosis it's again bun and creatinine, but because bun is not really a good indication in a child, so the creatinine is the best one. You see the increase of the creatinine is the range is from 0.2 to 1, so it's very good. It's a good indicator. So but we have to check bun and creatinine, but bun is not a good indicator, so we actually do only creatinine is the definitive indicator from 0.2 to 1.0. Okay, and normally what happens is like because of glomeruli edema and occlude with white blood cell, decrease of the filtration, sodium retention, so you absorb, so you hold a lot of water, and it's lead to increase of vascular volume. The diagnosis, we do a positive ASO titer for Staphylococcus, that in the rheumatic fever. The child usually pale, they have dark urine, and they loss of appetite. So nursing care is the most thing. What can we do for the child is avoid high potassium food, check daily weight, and give them antihypertensive, restrict INO, especially low sodium, and also bed rest. And here's a little extra tips for GU in the child is edema is a rule out for nephrotic syndrome. And how to wear diaper is that you just weigh the wet diaper and then subtract with the dry diaper. 1 gram equal 1 ml. So you drink water and juice, especially cranberry juice, that help to remove out of the all the infection and stuff like that. And you should see a care provider when bedwetting at preschool age. Unrepaired atrophy of the bladder is the risk for infection, straight catheterization for the child who not be toilet trained yet, low sodium diet for kidney, antibiotic as scheduled. Have to be as scheduled, otherwise it's not going to be effective. Prednisone put a child at risk for infection, teaching about specimen collection for urine analysis. Gentamicin is aminoglycoside, which is nephrotoxic, so we not give gentamicin to the patient with kidney syndrome. Cryptorchidism surgery done by 1 year. 3 months spontaneous descended. Drink fluid after planogram to flush the dye out. Okay, so here is the most important thing about this GU is that both nephrotic syndrome and glomerulonephritis have urine retention, proteinuria, so both of them are on restrict INO, low sodium diet, and weigh the patient daily. And that's it for pediatric GU. Okay, good luck with the exam. Bye.